It's the dawn of a new decade. You can be you again with Shatkin Mini Dental Implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Here's how Shatkin Mini Dental Implants will change your life.
I've had problems with my teeth.
I couldn't eat almost anything.
I'm gonna go and get this done.
There was no pain. I was very comfortable.
It's just unbelievable what it's done to my life.
And it makes you feel good. It does.
Kind of gave me my life back. Many dental implants made me feel like me, made me feel the person I knew I could be and always was inside. I would recommend it to anyone, and now I can smile and show the world.
Literally changed my life.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. I am welcoming Dr. Keleigh Lascari from Cornerstone Dentistry. We're going to talk about the mini dental implant. The mini dental implant will change your life. It is 5 times less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. The mini dental implant, FDA approved. It is a procedure where you can be you again. We're going to learn about that and learn about Dr. Keleigh Lascari in just a little bit from Cornerstone Dentistry. Welcome to the show.
Thank you so much, John. I'm really excited to be here.
I'm excited to meet you and find out all about the mini dental implant because it's so revolutionary, and you are the mini dental implant expert for all of New Orleans and Louisiana. And you have a model in front of you. It looks like a jawbone.
Right.
And you can now explain how the conventional implant versus the mini implant is so revolutionary.
Right. So we have a big hole here, and we have a very tiny, small hole here. The big hole is for a conventional implant. You have to remove a lot of bone to place the implant, and then you have months of healing before you can put a crown on or stabilize a denture. But with a mini implant, you just go straight through the soft tissue into the bone, and you stabilize the lower denture or give yourself a tooth in one day. It's just a life changer.
It is a life changer, and the difference in the size of the hole itself. The conventional implant's so large, the mini is just like a pinprick almost.
Yes, if I would recommend it to my family or friends, I would definitely go with the mini implant.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
I'm able to talk and speak with confidence again.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
When I go to the VA, I can give them a big old smile.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
It brought a lot of confidence back to me.
It's just amazing what it does for your self-confidence and how you feel about yourself.
After the procedure, wow. Yeah, you smile.
But now I smile all the time.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done to my life.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
Now, we all love our food here in New Orleans and Louisiana. You know, gumbo, jambalaya, and all the great foods. And if you have a denture, and some people do, and particularly the lower denture, it swims around in the bottom of your mouth. Dr. Lascari, show us how a lower denture is impacted with the mini dental implant procedure.
Yes, so I've worked for 8 years, and I've done a lot of dentures, particularly lower dentures. The lower denture, a patient, it just breaks my heart. They come back and they say how loose it is in their mouth. Can you do anything for me, doc? Like, I can't go out and eat. It falls out of my mouth, and I just don't like the glue. The glue really doesn't help. My saliva gets underneath the denture and it loosens it up. Can you do anything? And at the time, I didn't have these mini implants, and I said, well, that's just the nature of the lower denture. I'm sorry, I can't do anything for you. But now we have these mini implants. It just locks into place, and it stabilizes the denture. You can eat whatever you want, corn on the cob, juicy steak, you know, po' boy, bite into that French bread. It will change your life. It's amazing.
What's amazing about this, Dr. Lascari, is it's a sense of confidence that maybe that individual doesn't have because they've had dentures for so long. So that titanium post, which you saw as the implant, is what the denture adheres to, and it's affixed. So it's so stable it doesn't have a problem where it might fall out.
Right, right. So you can be confident going out in public again and eating. You don't have to be ashamed and have to tuck your denture in your pocket and eat without it because you're afraid that it's going to fall out of your mouth. You can go and enjoy and have a conversation and have fun with your family and friends again.
And the goop?
It's gone.
The goop is gone.
It is gone. You have to reapply the glue multiple times a day. And with mini implants, you don't have to use that glue anymore.
Now, folks, we're going to show you an upper denture example, and that sense of taste is going to come back, and Dr. Keleigh Lascari will show us why.
Right, so with an upper denture, you usually have to cover the palate to gain the suction toward the back of your throat. Well, the mini implants, you horseshoe the denture out and it locks in place too. And so when it's horseshoed out, you're exposing your taste buds on your palate so you can taste your foods again. And it's especially great for gaggers because if it's covering the palate and they gag and you horseshoe it out and you don't have the minis, you have to use the glue, and the glue really doesn't help to keep it in. Well, we snap it in with minis and you're good to go. Mm-hmm.
That's terrific, because that sense of taste that you've been not enjoying is now going to come back. So you can still have a denture and have that sense of taste. And again, the confidence, because the upper denture is now affixed.
Right.
I had a lot of difficulty in eating.
I couldn't eat 3/4 of the food that I enjoyed eating because I couldn't bite down on anything.
I hadn't taken a bite of a cheeseburger in probably 10 years.
I couldn't eat almost anything.
Well, you got to eat for the rest of your life. Do something now. So I did.
I can eat everything. It's unbelievable.
It was done, done. Let's go home and eat.
I can eat steak, I can eat sandwiches.
So it doesn't slide around or move or worry about it falling out.
I had dinner 45 minutes later.
Secured, it's in place, things don't fall out.
I can chew a steak. I could not do that before.
I'm enjoying the fact that I can literally get a sub and just run.
I have not had a problem at all.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
I love it. It's life-changing.
I can eat anything I want. I'll smile at anybody, you know. It's outstanding. I'm happy. I'm very happy.
I'm very, very pleased that I have them now.
I would recommend it to anyone.
The next example is what we call a fixed on 6. Right. This example is more like a set of teeth for upper or lower. Show us why.
Right, so fixed on 6, it's basically the next level up, and you don't have all this plastic in your mouth anymore. So you would have, it just looks like natural teeth, and it snaps on top of the minis, and it is still removable, but it feels a lot like natural teeth.
So there it is. It looks terrific. The fixed on 6, less plastic than a conventional denture.
Yes, you don't have all that plastic in your mouth, and it really does feel like your actual natural teeth.
And there's even a step up from the fix on 6.
Yes, so this is I would say the upper echelon here. This is actually permanently cemented in your mouth. It's called a roundhouse. You use about 10 to 12 implants, and it is permanently cemented in your mouth. It does not come in and out, and it's really is realistic of your natural teeth.
So the patient cannot take them out.
No, you definitely cannot take it in and out, and you don't want to take it in and out. It's just like your natural teeth.
Yeah.
Right.
Sometimes people have problems with teeth that are in the back of their mouth.
Okay, yes.
And, you know, I have heard others say that, you know, if it's out of sight, out of mind, but those teeth that are in the back of your mouth are so important.
They really are. So the front teeth are really just meant to bite into your food. Your back teeth are meant for really chewing your food in order for you to swallow and digest your food correctly. So it's very, very important to restore your back teeth. So what we can do, we would just place some implants in a row here, and then we have some teeth that are fused together. It's called a bridge, and you cement it in place. And it's a lot better than a bridge where you use your natural teeth, so you don't have to cut on those either. And then also, if a patient, has a sport accident or you had a car accident and you lose your front tooth, we can easily in one day place the mini and give you a tooth back. Maybe it's a temporary, but you're gonna have something there when you leave my office.
Look at how easy that is. It fits right in.
Mm-hmm. Yep. In one visit, we place the mini, give you a temporary, and you are leaving the office with a tooth.
We promised we're going to get to know Dr. Keleigh Lascari because from Cornerstone Dentistry, 16564 East Brewster Road, Suite 104, Covington, Louisiana. That's where you want to go. If you want to find out more information online, it's cornerstone-dentistry.com or cornerstone-dentistry.com. There are Mini Dental Implant Center of America, and the phone number to call is 985-231-0652. And in Covington, it's your practice.
Yes, sir.
Yeah, this is where you are set, and the mini dental implant is going to become such a focal point of what you do.
Right.
And with that practice, where did you grow up?
So I'm born and raised in Baton Rouge, lived there all my life. Went to college at LSU. Go Tigers.
Go Tigers! That's right. You got to go Tigers.
Yeah, and I went to dental school at LSU in New Orleans too. And whenever I graduated about 8 years ago, I've worked there in Hammond, and now I have my own practice in Covington.
Yeah.
Yes.
And that practice is meaningful, not only because it's your practice and now the mini dental implant is coming to Louisiana and New Orleans, but your parents were an influence in how you got to be the supreme dentist that you are now.
Yeah, so both of my parents were dentists. They actually met in dental school. They had their own practice for about 40 years in Baton Rouge. And my mom really paved the way for women in dentistry. She was one out of 2 women in her class out of over 100 students. So I always have to brag on her. But yeah, and I would always watch them at their office. I would look over their shoulder, and I was so intrigued by dentistry and what they were doing and changing people's lives through a smile. And yeah, and the dental assistant would always look up at me and she said, "You're going to be a dentist one day." And I'm like, "Really, you think?" She's like, "Oh yeah." So she was right.
But your husband's even involved in the practice.
Yeah, so it's pretty cool how my whole family was involved with, the practice. So my husband's an IT tech in Microland Computers in Mandeville, and he did all the IT work for my practice. My sister-in-law, Corinne, she did all the interior decorating there. And even my brother-in-law, he's helped out with the artwork too. So all the artwork you see, he's done. Even the frame around the artwork too. He's excellent, very talented.
Because when you go in to the practice that Dr. Keleigh Lascari is talking about, Cornerstone Dentistry, 16564 East Brewster Road, Suite 104 in Covington, the IT work for Cornerstone-Dentistry or cornerstone-dentistry.com, all that IT work is something your husband has put together.
Yes, sir.
And when you go into the practice, you have a very calm, soothing way that the patient can come in and experience something that really changes them, not just with dentistry, but overall.
Right. So that was my vision of opening my own practice. For 8 years, when I would meet a new person, they would look at me and say, "I don't like you, but don't take it personally. I just don't like the dentist." And I wanted to change that, and so my vision for my practice, the foundation was that people could come in and feel comfortable. It was very warm and welcoming, all the 5 senses, natural light flooding into the office. We have calming music going, we have essential oils going, and my staff is just really nice, down to earth. We want to get to know you. And then my patients call me the singing dentist because whenever I listen to music while I'm working on them, I'm like humming the whole time. And when I stop, they're like, why are you stopping? That was calming me down. And I was like, okay, well, I'll hum some more. So yeah, it's very peaceful at our office.
This technology with all of these models that you're seeing is a product and a concept that a dentist in Buffalo, New York has some patents on, and you've gone up to see Dr. Todd Shatkin from Shatkin First, and he's helped put this together, and you've learned from him, and you're bringing that technology back here to Louisiana.
Right. So Dr. Shatkin is truly a pioneer in mini dental implants, and He really wanted to do something that's best for his patients, and he found that technique. And when I watched it up in Buffalo, I went to take a continuing education course, and I was like, this is too good to be true. Like, is this for real? And it is, and I just want to give that same care for my patients.
So you're bringing that technology back because you are a mini dental implant center of America.
Yes.
In addition to that, you also offer some general dentistry as well,
Yes.
and cosmetic dentistry.
Right.
Yeah, and sedation.
Right.
Yeah.
So I offer oral sedation. If you're still very unsure about getting any dental work done, definitely have oral sedation to where kind of take the edge off.
Yeah, because that's something that some people feel more comfortable with.
Right.
Yeah. One of the things that people feel comfortable with is knowing that this can be an affordable option for them.
Yes.
And many of us buy a car and we pay for it on time, or a home with a mortgage. We should look at the mini dental implant as an investment in the individual.
Right.
And you work with several agencies to help make this an affordable process.
I do. So we really want it to be affordable for you. I know when you hear implants, you're like, oh, that is way out of my price range. I can't do it. But many implants are affordable. We have Care Credit and Lending Club. I even have an in-office dental savings plan. So we're here to help you in order to change your life through getting your confidence back with your smile again.
And that's very important. That smile, where you can be you again, is with the mini dental implant. They're 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive than the conventional implant.
Yes.
And when you go in, you have a free consultation. So you can work with the patient to find out exactly what they want. And when you go through the consultation, what do you get to know about the patient?
So really, with the consultation, I really want to sit down with you, listen to what you would like done, what you don't like about your smile, and we have all these options. You can actually pick up these models, I'll have them there, and you can touch and feel them, and just really choose which way you'd like to go.
You have something that's called the cone beam technology, and it sounds like a science fiction movie, but it really is another step forward in how you deal with the patient to take a look at their teeth.
Right, so cone beam is just a really fancy word for 3D imaging, so it really gets all angles of your mouth, so I can see your nerves and your sinuses and your bone and just know exactly where to place your mini implants. And 3D imaging is really near future going to be the standard of care.
Yeah, this is such a high-end piece. And
yes, sir.
If somebody comes in and they've talked to you about implants, and maybe they've called your office and they've been told, well, you don't have enough bone, and this is going to take months and months to figure out. The mini dental implant is not a part of that. The mini dental implant can use the existing bone. Talk to us about that.
So we can use whatever bone you have. With a conventional implant, if there's not enough bone, a lot of times you have to go through invasive surgery to put in a bone graft, and then you have to heal for about 6 months and then place the implant and let that integrate into your bone for another 6 months. And with minis, you immediately, same day, place the mini, and you can place the crown or the denture same day.
Same day. So
day.
Imagine that, folks. If you have a dental issue and you're thinking this is going to take months and months, this is not the case. And it happens right in your office.
Right in my office.
So when you go to 16564 East Brewster Road, look it up, Suite 104 in Covington, not that far away, right? Right, on the North Shore.
Right.
Yeah. Cornerstone-Dentistry or cornerstone-dentistry.com. It's happening right in the office.
Right.
Same day. Transformation, just like that.
Change your life.
People are amazed, and they should be, but this is something you're bringing right here to Louisiana.
Right.
Yeah, it's terrific. And the products are made in America, which we talked about, and it's a product that's made to really endure what a tooth is supposed to do.
Right.
Yeah, so you're going to be able to eat again and enjoy the foods that you love here in Louisiana, and no more accepting of soft foods. Some people have just resigned themselves to the fact that if they have a denture like my mom had, well, that's what I have to do and that's the way it goes. No.
No, it's never too late. Come in and this will change your life. When you don't have teeth or you have a loose lower denture and you're constantly having to just eat soft food that's not nutritious, let me give you your teeth back so you can have a healthy lifestyle again.
And you lose weight when you don't have to.
Right.
Yeah. And no matter what the age, I mean, I know you have some patients who are in their 50s and 60s, which is great, I'm in my 50s, it's okay. But if somebody's a little older and they have a denture, they should enjoy life.
Yes.
They should enjoy the foods
Yes.
that they love and have that confidence when they go to a
Right.
family function that
Right.
something's not going to happen.
Exactly.
So
Yeah.
that's why the mini dental implant is important.
Right.
We talked about that warm and welcoming feeling because so many people, I've heard, are afraid to go to the dentist.
They are.
Tell us why they shouldn't be afraid.
Yeah, so my office, it's just a very warm and welcoming environment, and this is really a comfortable procedure, and who can say that any dental work is comfortable, but it really is. Like, it's just a testimonial from other patients that have had this done. They say that it's super easy. I just had to take something over the counter for pain, and it changed my life.
It was totally painless.
What pain? I had no pain.
I didn't have any pain. It didn't hurt.
I never felt a thing.
There was no pain, no discomfort whatsoever.
One trip, it's great.
One visit, you're done.
Less trips, the better.
It's actually really painless, and I wish I would have got it done a long time ago.
So I did it, and I'm very happy with it.
It was good.
You have a very interesting story, Dr. Lascari, because the name of your practice and how that all came to be is really very personal, but I want to share that because I think our viewers would want to know that.
Yeah, so Cornerstone Dentistry, it's called that because God is the cornerstone of my life. Everything I do, whether it's my personal life or my work life, I give him all the glory and honor and praise that he's due. He gifted me with my hands to change a life through a smile, and I'm just really a humble servant here in New Orleans, just ready to make a difference and change people's lives.
Well, and you are, and at Cornerstone Dentistry, the line there is care founded on faith and trust.
Yes.
Yeah, that's your positioning line, and I think that's important. 16564 East Brewster Road. If you haven't been there, you really should make an appointment by calling 985-231-0652. The number's been on the screen, but write it down, 985-231-0652. And if you're watching us here on Innovations in Health for the first time, and you've been with us for the whole program, you're learning about the mini dental implant procedure. It's going to change your life where you can be you again. But if you've joined us midway through and you're seeing these models in front, you're thinking, what is this all about? Dr. Lascari is going to tell us, because this is something where you really are going to change lives. Let's look at the models, and let's start with the lower implant.
Sure. So with a lower denture, I'm very used to seeing patients that come to my office and they say, this lower denture, it just swims around in my mouth. It's falling out of my mouth. I'm totally embarrassed to go out in public and eat, and I just stay at home and I'm depressed. And can you do something for me, doc? And now I can say, yes, I can change your life. I can give your confidence back, and you can eat whatever food you want to eat. So it just locks into place really easy.
So it's not swimming around
It's
on
not.
the gum, and the goop is gone.
The goop is gone.
Yeah, let's
yes.
take a look at an upper denture example, because if you have a lower, odds are you might have an upper.
All
But
right.
now the taste is coming back, so all the great foods we love in New Orleans is now yours to enjoy again.
So with a conventional, traditional denture on the top, it usually covers the entire palate to gain the suction. But we can hollow that out, horseshoe it out. It's a lot thinner. We expose the taste buds on your palate so you can taste your food. And just like the lower, it locks into place, doesn't move around, don't have to use that goop anymore.
And if you're a gagger, like you had mentioned
Right.
earlier, that's not a part of it.
So if sometimes a patient, if they gag really bad, because the denture has to go kind of towards the back of your mouth with a traditional denture, we would have to horseshoe it out so they don't gag, but then they would have to use glue to keep it in, and that really doesn't help. You have to reapply it multiple times during the day. But with mini implants, we just snap it in, glue's gone, and you're good to go.
Good to go. The titanium post holds it into place. We have an example of what we call a fixed on 6, and this is more like a full set of teeth.
All right, so the fixed on 6, we typically use 6 implants. You don't have all that plastic in your mouth. It's going to feel very similar to your natural teeth, and you put it in just like this. It locks in, and yeah, it just functions pretty similar to your actual natural teeth.
So it's the upper or lower, or both, that could be the fixed on 6. And with the Fix on 6, it looks great, but there's an even better design. And this is the roundhouse, because if God gave us our baby teeth and our adult teeth, Dr. Keleigh Lascari is going to give us our third set of teeth.
Right, so this is as natural as you're going to get with what God gave you. So we'll put a couple more in compared to the Fixed on 6. This is permanently cemented in your mouth. It will not come out. You don't have all that plastic again, and it's very strong. You can eat whatever you want.
And these are porcelain, made in America products. And if you have teeth that are in the back of your mouth, you can't neglect them.
Right.
You may have one or a few teeth, and the mini dental implant procedure will help recreate the shape of your mouth and give you that chewing power to get the nutrition out of your food.
So if you're missing some back teeth, we would just put some implants in a line here, and then we use, a couple of crowns that are fused together. It's called a bridge, and we permanently cement this in place. You don't have to touch the teeth on either side, which normally a traditional bridge you would have to do that. So we're not even touching those teeth. And also, if someone has a sports accident or you have a car accident, your front tooth is missing, same day, put the mini implant in, give you a tooth, and you're
And
good.
look at that. These are the examples of how you can be you again with the mini dental implant with Dr. Keleigh Lascari from Cornerstone Dentistry, 16564 East Brewster Road, Suite 104, Covington, Louisiana. Online at cornerstone-dentistry.com or cornerstone-dentistry.com. And Mini Dental Implant Center of America, the number 985-231-0652. And I know we talked a little bit about the faith-based piece of your practice, but you also give back to the community as well. And I think it's a beautiful story based on your childhood love of dancing.
Yeah, so locally, every time that we see a new patient, I'm blessed to give a foster child right in our community a brand new pair of ballet slippers. And it just really warms my heart because dance gave me a sense of belonging and purpose in life and shaped my identity and gave me discipline. And I'm just really excited to give that back in our community to the foster children here.
That's great. What's the name of the organization you work with?
So it's James Samaritan. So they help foster parents provide for their foster children, and especially extracurricular activities like dance.
And you have a great passion for going on a mission trip to Guatemala.
Yes, so not just locally. I in dental school went to mission trips in Guatemala and Peru, and my heart was in Guatemala. So once a year I went to bring my team members there and really just care for the people in Guatemala.
It's a beautiful story, and
Thank
this
you.
is the kind of dentist you're going to meet when you go over to Cornerstone Dentistry. Dr. Lascari is a member of the American Dental Association, the Louisiana Dental Association, North Lake Dental Association, St. Tammany Chamber of Commerce, the International Academy of Mini Dental Implants. So you're vested.
Yes.
This is it. You are the mini dental implant expert for Louisiana and New Orleans. And again, the address is 16564 East Brewster Road, Suite 104, Covington, Louisiana. The phone number 985-231-0652. It's been a delight to meet you, Dr. Lascari.
Oh, thank you, John. I had such a wonderful time.
Yeah, you are an innovator in health right here in Louisiana.
Yes, thank you.
Thank you for joining us, and thank you for watching.